my selling points on pediatrics specifically are that it's truly a privilege being able to work with children and their families along that journey, and being the person that they're looking to for guidance and developing that trusting relationship with those families.
There's a lot of need in the communities rather than in big centers. To find a developmental pediatrician in the community, very hard. Most of them are in hospital. I also encourage them to continue in this specialty, but also in the community, because they will be very, very needed in the community with those special education they've been getting.
I think sometimes people don't realize that in community peds, you also have the chance to do some of that more subspecialty work. You can create this incredibly diverse practice. I think that's just such an exciting part of our job, and what really should entice people towards community pediatrics. So I think community pediatrics is a great way to be able to not just practice all the typical things that you would imagine within pediatrics, but really develop some unique skill sets that can keep your practice interesting and also can change throughout your career. So you're not stuck with always doing the same thing for 30 or 40 years. Like, you can focus on something for a while and then switch gears a little bit and do something a bit different and develop another skill set. And community pediatrics allows, I think, for that opportunity more than almost any other area of pediatrics.
Take a step back and reflect on where you are in your life and what actually matters would be my biggest advice. Reflect on where you would want to be in about 5-10 years. How would you see your life as you decide where you want to live and practice and perhaps choose to raise a family? It's a very different situation. So just step outside the box, I say.
Do it. It's great. No, it is. It's great. It's awesome. It's one of the most rewarding careers I could ever imagine.
I would say, finish your residency and then do a year of locums and check it out. And travel a little bit. Come to Yellowknife, go to Whitehorse and help Catherine Smart and the rest of the gang out there to see the country and do some medicine and actually contribute. Take advantage of that and then learn how to practice medicine as a general pediatrician. And if you don't like it, you can always go back and do something else. But I'm willing to bet you'll probably like it because it's pretty cool. It's a pretty cool job. I can't think of a better job, actually.
I would tell myself, ask for help, ask your colleagues, bring in another pediatrician. Feel free to tell the emerge doc, I'm not comfortable intubating a teenager. Can you do the intubation? Those would be the things that I would tell my younger self. And if it was someone else, but not me, I would tell them, absolutely, consider moving out of the big city, move into a smaller community, find a practice that has a good mix, and make connections with people all over the province or country that have similar jobs to you.
I would just say, enjoy the ride. Take advantage of whatever is given to you with options or advantages or opportunities. Like I can't think of a better life, better job. My career's gone really well. Yeah, if you talked to me 23 years ago and you told me I was going to be a president of CPS one day, I'm like, yeah, whatever. There's no way. I did what I like doing, and I would tell myself that 23 years, just enjoy the ride. Just take opportunities as they come up. And if you don't like it, don't do it again. And if you do, continue with it and just enjoy. Life is great. Like, you just gotta go with it.
Yeah, I would just tell myself that it's okay to not know everything, or to tell a family, I'm going to think about that a little bit more, and I'm going to get back to you once I've had a chance to either think about it more, or maybe email or call a subspecialist or talk to one of my colleagues. And that's okay, and that medicine is a ongoing learning process, and don't be too hard on yourself. The resounding answer is yes. We love having trainees come and work with us, and if it doesn't work out for a particular time, we're very flexible too about trying to make it work if it doesn't, or find another time that would work. So yeah, I'm very happy to answer questions and to be a contact person for people who are interested about doing electives here.
Yes, yeah. So I'm actually the our pediatric site lead preceptor. I know as I was a resident of Queens and came here and did a rotation in residency, I can tell you I loved it. And that's really been echoed through the feedback that we got from a lot of our learners, is that this is a great place to come and try out community pediatrics, see what it's like. Also, it's really fun here. It's really a great place to hang out. I think people that come here from other places really enjoy their time, both in and out of the clinical setting.
So it's tougher here because we have pediatric residents that come up here, and we have a family medicine training program here in Yellowknife. So it's really hard for us to fit medical students in. But I know, residents, we have one spot that's for non-U of A residents per year, and we usually get 3 or 4 people applying for that one spot. So it's pretty hard to get here. But I know that Catherine Smart and Sarah Citron in Whitehorse have taken residents, and they're happy to do that. Iqaluit is another northern place that does take residents, but most of them are from Ottawa. But I think if you put your name in, and all you do is reach out to people you're interested in or interested in going to, and join a section, come to the CPS annual conference, and then and meet people. That's what CPS is to me. It's a bit of a social event to meet people who do the same thing and are passionate about the same thing as you are, and sharing that joy of pediatrics.